A very good afternoon and warm welcome to this special edition. I'm Gawat Tegule, old-timer, and happy to see each one of you again. And I hope you're happy to see me again too. Talking about something very, very unusual, kind of looks or sounds commonplace, leadership in sanitation. And what kind of topic is that? Somebody might be asking. Leadership and sanitation. But we'll be telling you why we're here, talking about sanitation of all things. But again, come to think of it, sanitation is a matter of life and death quite often. As a matter of fact, it determines whether you live or die if you're in particular situations. And that is why it's nothing to laugh about. And that's why we feel it's just about time we talked about it. I will shall be giving you a quick background to this after I introduce my guests. In the blue corner, if I can call it that, from my boxing days, we have engineer Francis Musenguzi. What kind of engineer are you, Francis?
I am a water and sanitation engineer.
Ah, okay. I was trying to draw the correlation. An engineer, then talking about sanitation and saying, where's the nexus? And where are you from?
I'm from Water Aid Uganda. I'm the country director.
And what are you doing in Water Aid?
So in Water Aid, we advocate for the role of water and sanitation and hygiene in national development.
So you talk without doing anything?
We actually also do work, but that work is used to give us evidence, which we now use for working with the government to show that we need to invest more in sanitation. Because
every time we talk about advocacy, then there's much talk and no work.
No, I've seen this. Because I'm an engineer, I actually mix the two. There's what we call service level advocacy. So advocacy with evidence. Do it, and then work with people to dialogue about how better that can be improved. And that's why we said leadership is required, so that there is always thought leadership and increment a better way of doing something.
Okay, yeah. And the lady, no gender balance here, somebody might be, the feminists must be screaming, no gender balance, 3 men, one lady. But we have Julian Chomhanji, who is Assistant Commissioner in charge of environmental health in the government. Talk to me about what you're doing, Julian.
Thank you very much, Mr. Tegure. As you have said, I'm Julian Chomhanji. I head environmental health in the Ministry of Health and the whole country. And my job is to see that environmental health issues are delivered to the people where they belong.
It sounds a high, it's a high sounding title. What exactly? We'll just break this down for us common men.
When I break it down, the common word is
environmental health.
And hygiene.
No, environmental health.
Environmental health. It has components, and sanitation and hygiene is one of the components. But we have air pollution, we have safe water chain, we have noise, we have inspection, we have food and hygiene and safety, we have solid waste management. All that is under environmental health.
So where do you sit?
I sit in the Ministry of Health.
And from the safety of your chair, you're inspecting the country?
No, I have staff. I have a team. I can't do it single-handedly. I have a strong team which works with me.
Okay.
We work as a team.
Fine. And last but not least, we have all the way from Kole District. What the heck is Kole District? That's a district I'm sure many of our viewers have no idea it exists. But there is a district called Kole. Where is Kole?
Kole is in the Lang region. It was carved from a patch. That was 210. So we're about 8 years old. Yeah, it's a small district. It has been one county until a year back when it was broken into 2 counties. But practically we are still having one sub-district.
Okay, great. Yeah. And your capital is still Lira. I mean, the regional capital there.
Yeah, fine. But we have our own
of course, you have your little towns. Every small trading center is now a town council, a town board, or something like that. But the biggest town nearest nearest you is Lira.
Yes,
how far are you from Lira?
20 minutes drive.
20 minutes away from Lira.
Yes.
So did you need a district?
Yes.
20 minutes drive, you still need a district too.
Yeah.
You should have stayed.
Yeah, considering the population, it has its large population to cater for, so there was a need to have a district created from this side. In any case, we were carved from a patch, not from Lira.
Not from Lira.
No.
Okay, we're happy to welcome Dr. Ega Jimmy, who is the District Health Officer of Kole District. Let me go back to ladies first policy. Julian, talk to us briefly about leadership in sanitation. What, from the common man's perspective, how are we supposed to understand what you guys call Sanitation Week?
Why we chose to focus on leadership in sanitation? Because we feel if the leaders come on board, we'll score. They will help us to reach every person in the country. You know, we have very strong leadership. We have LC1s. We have leaders are not politicians, by the way, only. If you're a headmaster, you're a leader. If you're a family man,
wait a moment.
you're a leader.
You're telling me you want leaders to come on board?
Yes.
So all these 50, how many years of independence, leaders have not been on board?
They have been
in
on
sanitation?
board. They have been on board.
So what are you talking about?
Because when we look at the trends of sanitation, and we measure sanitation and hygiene using a latrine as an indicator, that's why they say they are doctors of latrines. But we are not doctors of latrines. We help people and support them to have latrines. That's why they call us doctors of latrines. And we want the leaders to help us with the community. Because the problem, most of the problem is in the communities. And that's where our sanitation is really bad.
Okay, great. And if you like, viewers may want to know that Sanitation Week is the week preceding the World Water Day, and it is celebrated globally every Friday, every 16th of March. And this year it falls on Friday, and that means that Friday will be World Water Day. And the main celebrations will be in Nkole District. That's why he's here. Talk to us a little about what we're going to see in Nkole that day. Is the president going to be there?
Yeah, we expect the Minister of Health to be the chief guest.
When you talked about leadership, I thought we were going to see the president in Nkole.
Maybe he has a lot of duties on his table.
Other state duties, no problem.
But we are told the Minister of Health will be the chief guest. But we, of course, we expect a lot of other dignitaries.
But these are the national celebrations.
Yes. Yeah.
So what is going to be happening there?
Being a national celebrations, of course, all this will converge there. Okay, we shall have representatives from all districts converging in Nkole. But as it has been said by the commissioner, this is a commemoration for purposes of people getting more aware of the importance of sanitation, safe water use, and hygiene. Okay.
Okay.
So this function provides an opportunity for increased awareness to communities towards these causes, because we are aware that these, if not managed well, have bad impact, great impacts on the health of individuals and the communities as such. It has public health implications. For example, we know that a number of diseases are related to sanitary poor conditions.
Like?
Quite a number, like diarrheal diseases, for example, acute gastroenteritis under children, I mean under 5 years especially. We have cholera, we have typhoid, we have dysentery, we have polio. Even polio is transmitted by people eating fecal matter. We have hepatitis A and E. Those are
even hepatitis?
Yes, A and E. They are transmitted by, taking in food or water contaminated by feces, which has these viruses. We have NTDs, like soil helminthiasis, these worms, I mean intestine worms, which enter the body through the skin. If somebody has littered the feces around and you walk barefooted, you can get these infestations. We have diseases like elephantiasis, conditions where people's legs swell. It is also due to indiscriminate disposal of waste, fecal waste. We have schistosomiasis, okay? If people, this bilharzia, if people go to defecate and urinate in waters, and this person was infected, you will dump their eggs. Now these eggs will find the appropriate susceptible snails. The life cycle goes on there, and the worms come out, larvae. Then another person can be infected if that person gets in that water.
Okay. And so there's basically lots of health implications when it comes to sanitation.
Yes.
And if you're trying to draw a nexus between this and development, is there any that we can find, engineer?
Yes, big nexus. One is that we must know that this is not only about Uganda. Worldwide, this is recognized. The Sustainable Development Goal number 6. the need for water and sanitation that is sustained to ensure that we have better livelihoods for all people in the world, men, women, children alike. So when you look at Uganda's development plan, when you look at Uganda's vision, it does recognize that. Within the Ministry of Health, if you see how many patients are sick due to water and sanitation related illnesses, if this was addressed, you would have all that money saved within our national cake. If you get into the schools and look at how many girls are dropping out of school because of lack of proper sanitation facilities due to lack of menstrual hygiene management, 51% of girls dropping out of school. That is a lot of money lost that would have been contributing to our GDP. If you go down and look at the household level, those are the same issues, amount of time lost by the mothers, by the fathers, by the children, by going out to, indecent sanitation facilities. That is all money that is lost and which would have contributed to our GDP. So indeed, sanitation is well linked to our national development plan and must be seen as a bigger development priority. And that's why the call here is to ask all leaders at the global level, development partners, the president, the ministers, the parliament, in terms of legislation, at the ministry level, the strategic investment plans. Where is sanitation in the Ministry of Health? How much profile do we give to preventive health, environmental health within the Ministry of Health's budget? How much budget is given at the district level to ensure that what the doctor has described, sanitation is well addressed and given its position? So we are advocating and calling all leaders and saying everything rises and falls with leaders. We're asking leaders to prioritize sanitation. Leaders prioritize discussions on budget, on planning, on monitoring to ensure that sanitation is given its priority within our development context.
Great. And as government, do we have any policy on sanitation in terms of prevention, especially in terms of emergency responses in when there are outbreaks of epidemics? Is there a particular policy or policy framework?
Yes. We have an environmental health policy, which covers everything, because we didn't go single to single out sanitation policy. Because environmental health, as you have seen the way I described it, encompasses very many things. And we have guidelines, and we have strategic plans. We have strategies which we use to implement, to deliver services to the people of Uganda, so that sanitation and hygiene improves in the country.
And how often are those policies followed?
The policies are being implemented. They are not only followed, but they are being used by the implementers, and they are used to implement services, to deliver services.
No, because I think the cliche in this country is that the policies are always there. It's just the implementation that is just never maybe there completely, or is never passionate. And therefore you have all emerging crises, yet there are policy frameworks that could have prevented them in the first place.
I think they are working, because why they are working, that's why we are saying Sanitation Week, the leaders, how is your leader? That's the theme. The leaders must live by example. You can't lead the people when you don't have even the facilities at your household. Sanitation is not only one word, but includes a lot of issues. You must have a good house, a good kitchen. You don't cook in the same house. We are talking the rural. The urban are liberated, but some of them are still cooking in their households. If I'm living in a one room, where do I cook? All the smoke comes to me. That is the pollution we are talking about. If you don't have a latrine, that means you are doing open defecation. All that is sanitation and hygiene practices. And that's why we are tying the leaders, that the leaders must live by example.
Yeah, but I wanted to take you on just a small point before Doctor comes in. Where does government come in all this in terms of intervening in situations where there's extreme poverty and therefore inability to afford the situations, the dichotomized kind of arrangement you're talking about? You have a toilet that way, you have a kitchen that way, you have sitting room this way, bedroom that way, like you're saying, the rural areas. How does government intervene in extreme poverty?
I think government has intervened. I will not open what I am not really having data, but I know government is helping the elderly, and people have formed groups, circles, where they come in. If you don't have a latrine, they help you to build a latrine. There are women groups. Actually, it is mostly women who are doing all this work in the rural areas. They come as a group. If you don't have a latrine, they build it for you. Because, you know, when you look at Sustainable Development Goal number 6, it says universal access, leaving no one behind. That means even the vulnerable, we are taking care of them by building capacities of those who are able to help those who are not able. You know very well government will not come and build you a house. Government will not build you a latrine. But we want the leaders to lead by example and make sure they live in a clean and healthy environment, and then the communities will follow. That's why we are tying the leaders, and next time we tie the health workers. Since we are health, we must lead by example.
To be fair, I see many of them come here to Serena. They use the bathroom. They don't even wash their hands after. I don't think that's leading by example, but we can discuss it over coffee. Doctor, talk to me.
Yeah, I just wanted to add on what the commissioner was saying about policy, that even under the constitution of Uganda, which was made in 1995, it is stipulates clearly that sanitation and hygiene is the right to every human being. So it is there in the constitution that we must provide favorable sanitation and healthy environmental conditions, including safe water supply to all Ugandans. Even under the Kampala Declaration of Sanitation, I don't remember when this was made.
1997.
Yes, sanitation and hygiene are highly emphasized, and they talk about leadership and commitment, community mobilization, and intersectoral, support. Yes, yes. There is also the Public Health Act, which under Chapter 281, Section 55, which talks of duties of local authorities to maintain cleanliness and prevent nuisances. Okay, every local authority should take lawful and reasonable measures to ensure that all citizens have a clean environment and have good sanitary conditions. Then there is also the Local Government Act, Chapter 243, Section 38, 39 and 40, which mandates local authorities to formulate bylaws and ordinances to promote sanitation and hygiene in families.
Yeah, but that goes back to my earlier query to Julian, that you have all these declarations, all these resolutions, and still you have emerging, outbreaks emerging all the time. Cholera here, dysentery here, this and that, and like these are basic sanitation issues, and more than 50 years after independence, we still have these problems. It means, as government, there is a problem. There's something you're not getting right.
But if I may say something about Kole, in Kole, as a local government, what we have done is that with the environmental health department spearheading, I have an EDHO in charge of environmental health. He has a team of health inspectors, health assistants, who work as vegetation workers. They go out always, sensitize the communities, involve leaders at all levels, and they are all supportive. Committees have been formed at village level. There is a village sanitation committee, parish, sub-county level, and even at the district. So sensitization is routinely going on to ensure that all these necessary conditions are in place. Good toilets, okay? Not merely any structure, but a good toilet. Yeah, a toilet which has a door, a toilet which is sizable, height, width and length, distance from the kitchen, distance from water sources,
That is okay.
And so on and so on. So there is a lot we are actually doing. We are monitoring, we are supervising, we go out and verify whether villages have attained the status of ODF, that is open defecation free, certify them, and that helps to motivate other villages and households to emulate.
I think
that would still get back to why do we have all these huge outbreaks which have to do with sanitation. But we shall be getting back to that after the break, because we're talking about leadership in sanitation. We are raising fundamental questions about is government doing enough in terms of playing its role in maintaining sanitation, a high level of sanitation in the country? Are we spending enough money in that direction? Are the leaders doing enough to prevent rather than to react? And when they react, are they reacting fast enough? Do we have the facilities to react fast enough when epidemics break out? Because sanitation, like we said, is many times a matter of life and death. We'll be back after this break. Stay with us. Welcome back. I'm Gawat Tegule. I'm talking about leadership in sanitation, and we say that Sanitation Week precedes World Water Day, which is celebrated every 16th day of March. That is every year by the entire world. And we're talking about where is government in all this. I'm joined here by, from government, I have Julian Chomhanji, Assistant Commissioner in charge of Environmental Health. I have also from civil society, Engineer Francis Musinguzi, Country Director of Water Aid. And last but not least, all the way from Kole, I have Dr. Eiga Jimmy, who is the District Health Officer there. And he'll be talking to us a little more about what Kole is doing and why Kole has been selected as the venue of the national celebrations this year at Omuge Primary School, Bala Sub-County, Kole District, very small district, but then how many districts are big these days? But let's go to the issue of, Julian, let me go back to you on this global perspective on sanitation. What is the quick background on this?
Thank you, Mr. Tegure. In 2004, there was Africa Sun Conference. It was held in Senegal, Dakar. And you know there is AMCAW, African Ministers Council on Water. And whenever conferences of such come up, sanitation was always swept under the carpet. It was not coming out. It was not being prioritized by governments. So the ministers of water, the Ministers Council on Water, agreed in principle that to bring sanitation high on the agenda by countries, we must have a sanitation week. And they said, which week can really be prominent? As you have well said, the sanitation preceding World Water Day. As we talk now, World Water Day will be celebrated next week on Wednesday. So that week preceding World Water Day was selected globally to be a sanitation week, where activities geared towards improving sanitation and hygiene practices was conducted and celebrated at the end of the week. That's why we started on 11th of March and we are crowning it on Friday, 16th of March, so that we give way to the World Water Week 2, which is starting on Saturday. Fantastic. That's the history of Sanitation Week.
Fantastic. Doctor, you are itching to say something before I go to engineer. 30 seconds.
Yeah. There was a question which I probably did not answer fully. When you asked about why epidemics keep coming up, sanitary-related epidemics, and under this we often
amidst all your policies and resolutions.
Yes, we see polio, we see hepatitis, we see cholera, typhoid, you know, and sometimes dysentery. I think there could be a number of reasons, but one, in my thinking, could be that we have porous borders surrounding us. So we keep getting people moving into the country anyhow, without being checked. The immunization status is not checked, so they come with infections, okay? And some of these neighboring countries don't undertake immunizations seriously. So there's a lot of incoming of people who have infections and they spread to our communities. So that is one. Insecurity in neighboring countries. For example, right now, there are many refugees going to Changwali, going to Chegegwa from Zaire, and you are aware of the epidemic that has been going on there. Yes, because of these circumstances.
Yeah, then but does government, isn't government aware of the fact that refugees are coming in and therefore they need to react and prevent, you know, actually react quickly in the sense of we have refugees coming in, let us take emergency measures to prevent any possible outbreak. That's responsible government. You want to answer that?
Yeah, I mean, let me pitch in here, and I really would beg to disagree on this part. Yes, there is a contribution of the foreigners who are coming in. But when I make a dichotomy of our country, you see these breakouts in different parts of the country, even where there are actually no refugees. But when you want to analyze this fact, is that to look at our health monitoring system, how much attention is given to sanitation. Practically, yes, we have a constitutional statement, Article 39J, but the devil is in the detail. How is this implemented? Is there adequate money in a district budget for sanitation? Is there adequate money at the household level that is availed by the heads of households to ensure there is sanitation? Is there adequate money for monitoring of these sanitation plans and in fact for implementing some of these regulations? When I look at health workers, yes, they are there, but you know, because we are civil society, we have done many studies and findings where in fact you find the amount of fuel that is allocated to health worker. Sometimes it's shameful to actually even put it on paper. And for me, I see it's a time for us to come out boldly and say, government has declared we want to hit a middle income status by 2020. And getting a middle income status prescribes the level of the dignity of the people, including sanitation. For us to hit that target, it means we must increase investment to sanitation by 8 times of the current budget. So for me, these are the kind of things. Number 2, when you look at the Ministry of Health, how much of that budget is allocated to prevention rather than to the curative side? It has been emphasized by the president that our health should emphasize the preventive side rather than the curative side. But how much budget within the Ministry of Health is allocated to that? If I look at the divisions in the Ministry of Health, how many divisions, in fact, are put together to monitor prevention rather than the curative end? So they are all important, but I'm saying as a country, this is where leadership comes in terms of making priorities, making sure that our strategies are clear. For us to achieve our targets for 2020 as a middle income country, we must invest more in sanitation. We must prioritize the place of sanitation in budgeting, in monitoring, and also to make sure at the district level, it is not only in paper, but is practical, and we see it giving us the results as intended.
Great. Let me just tell the viewers that to break down this in a very simple manner, you need to understand the impact of sanitation on health, and beyond that, on your existence. That if you go to a cholera camp and you see people dying freestyle, it tells you the importance of good sanitation, the importance of preventing crisis in the first place, even before we try to build a capacity to react to emergencies. You watch a person dying very, very quickly in a matter of days. How many days does it take for a cholera victim to die? Like when in acute situations?
Hours.
A matter of hours. Just listen to that. A matter of hours and somebody's gone. That is why we emphasize sanitation. It's not a matter of, it's not just a pleasant banter on television. It's about life and death. So let me just go back to a little more to Engineer Msinguzi. As civil society, what are you doing to make sure that citizens achieve a clean and safe environment to live in? By the famous, did you say 2020 or 2030? Which was the SDG? 2020
is the middle income status.
That's middle income status.
SDG is 2030. There's also Vision 2040 for Uganda.
Oh, heck. Okay.
So civil society, we are collaborators. We are
what is there for 2050? I mean, it seems there's a milestone for everybody. Okay, talk to me.
As civil society, we are allies. We collaborate with the government. Doctor has said it so much. So good, commendable efforts that have been invested in this, and Commissioner has also mentioned that. But our place as civil society is to stand and say, yes, Article 39J says water and sanitation already recognized as a right, but how can that right be implemented? Are there gaps in the implementation? Starting right from, you know, the political parties. When you look at the manifestos by political parties, do they actually stipulate how sanitation is going to be implemented? When you look at what you call the opposition governments, does the opposition recognize their voice and role in challenging government as an alternative mind in terms of deliberating or implementing sanitation?
Wait a moment. Which opposition governments are we talking about here?
I mean, all countries in Africa. Even if you come back here to Uganda, if I look at a manifesto, it must be creating a position where the alternative government is saying this is the way this should be implemented. So we have policy legislation, we do dialogues on policy, we have service level evidence generation. For example, we've been running a program in Eastern Uganda that looks at trachoma. Trachoma it's a water related, sanitation related illness. But saying prevention of trachoma, we usually look at the medical side, the curative side. But then there's the prevention side where it talks about face washing.
Okay.
How can you make sure that trachoma is eliminated in Uganda by having the two combined?
Okay.
It is a strategy. So that's the kind of research that we do. We look at, Kampala City. Yes, we have huge discussions on sanitation, but only 8% of Kampala has a sewage line. These are kind of discussions. So how do we reach people that are in places that cannot be reached by this sewer line that was actually even put down by the colonial governments? So these are strategies. How do we make sure we work with the private sector, pit emptiers? How do we make sure that KCCA has the ability to regulate the pit emptiers, but also collaborate with the national water, but keeping an eye on the Ministry of Water as a regulator? So we have had a lot of collaborative work within Kampala by putting together what we call a sanitation forum. And the civil society will come into play with the government at the national level, at the district level, but also understanding that at a service level, sanitation is not only a toilet, it's also about pit emptying, it's also about understanding its effect on the water resource. So all these coming together into a coordination mechanism. That's why civil society has to work with the government to make sure that sanitation is prioritized in the government to make it a reality.
Great. And like we said, sanitation is not just pleasant banter. It has great implications, matter of life and death, but it also looks at your local economy, your household income. You don't want to spend money on treatment when this money can be put elsewhere by simply maintaining a very sanitary environment. I'm talking to Engineer Msinguzi, Julian here, and all the way from Kole, I have Dr. Eiga. And later on, I'll be taking calls. I'll want to hear from you. That is in the last segment of this show. But I want us to look forward. We're talking about forging a way forward. What would we propose? Let me begin with Dr. Eiga. You're on the ground, up country, but on the ground, you know what is happening there. If you're proposing a way forward, what would you look at?
Maybe
before that, yeah?
Yeah. Mr. Tegure, before that, I think the ministry has realized the questions you're asking, and there is a shift from curative to prevention.
That's a very political statement. I've had that before on many fora. You're not the first one to say it.
No, I'll defend it. I'll defend it.
I'm saying, what else is new?
I had a division, but they have turned it into a department. And departments, there's where budgets are controlled. So we hope come 2018-19, the department will be operational. And then environmental health will be high, and we'll have a bigger budget.
And by then, how many
people
will have died?
So it is not a political statement.
By then, how many people will have died?
But we are left with a few months to reach July and start a new year. You can't start a department in a new year.
Julian, I know how slowly government moves, and we know the implications of that on the thing, on the common people on the ground. You know what that means. But let me hear from Dr. Eiga as a way forward.
I want to agree entirely with what the gentleman said about funding. Engineer Msunguzi about funding. The low funding to the health sector, especially to sanitation and the water supply. It is quite true, and it needs to be really addressed. Because, for example, Kole, we have been able to do something because we have been under those few districts. I think there are 15 which are receiving the Uganda Sanitation Fund.
Allow me to talk.
Okay.
Okay.
Yes. So we get this money is what has enabled us to fulfill the sanitation standards in the districts. Otherwise, without this money, I don't know how things would be. Because PHC funds are quite meager. PHC funds that come to the districts.
PHC is
primary
health care.
That's for operational purposes.
Okay.
At district office and the lower centers, the money is so meager.
So funding is one. What's the second?
It is an issue. Then, of course, for Kole, human resource, we are doing well, apparently, because we are over 80% technical staff.
But at a national level, what do we need?
Yeah, but nationally, there are so many
gaps.
Are doing badly with the human resource. Yes. So that needs to be addressed. And issues of transport. Quite a number of districts don't have appropriate means of transport.
Means of transport or basic road access? Which is which?
No,
or
means of transport to reach the communities, for example.
Are the roads there? Are they good enough?
That is also another issue. The road system needs to be improved, but by the local districts. but even the means to move down to the communities, because they need to go to the communities on a regular basis, on a daily basis, on a household campaigns, okay, by especially the extension workers. But if these people don't have motorcycles, you can't expect them to move on bicycles or on foot, okay? Reliance on VHTs. The VHTs have done a very good job, by the way, because they are always in the community. Yes, but you know, they have been under voluntary sort of arrangement, which is unsustainable.
They need to be paid.
They need to be.
Okay, I'll cut you short there because we need to take a break. But as you can see, there's a combination of factors, a lot of things that need to be done, and they need to work together in tandem. No single solution, but a combination of factors working in tandem. Let the wheel roll, and things will get better. Your calls after the break. We'll be back. Welcome back. I'm Gawa Tegule. I'm talking about leadership in sanitation because Sanitation Week is the week preceding World Water Day, which is celebrated every 16th of March, and that is every year. And Uganda, like the rest of the world, will be converging at Kole. Kole is in the northern Uganda, north central, if you ask me, just off a patch. And we shall be celebrating World Water Day there. And before that happens, we want to talk a little bit about sanitation, its importance, especially what government is doing or not doing. Julian here insists government is doing well. Engineer Francis doesn't think so. But well, anyway, there's Engineer Francis Msenguzi, Water Aid Country Director. We have Julian Chomhanji from the ministry. And of course, I have Dr. Eiga from Kole District, all talking about leadership in sanitation. Julian, briefly, government, you said, you insist is doing something. Yes. What have you done?
Yes,
in a few words.
Government is doing a lot of work. You know, when you have a good leader, you get friends. So we have partners. We have development partners who have come in to support the sanitation causes. We have a global sanitation fund, and it is running in Teso region, West Nile, and Lango region, and some parts of Eastern. And if you go there, villages have been turned into open defecation free, using home improvement campaigns, using community-led total sanitation, with its subset of Forap Mandona. Things are moving really in the right direction. And I think that is something we should really be proud of.
Proud of. We shall hear from the viewers. Talking of which, phone lines are now open. You can call in and share with us your views. Sanitation in this country, how far have we gone? How much farther do we have to go? And how long should things stay this way if you think they're not okay? But Julian, you're saying something.
Yeah, because with that funding from our good friends from Geneva, from an organization called Water Supply and Sanitation Collaborative Council, gave us funding, and we have turned tables in the sanitation arena. Great. We have open defecation sub-counties. A whole sub-county is turned open defecation free, and yet in the beginning, we were at 45% latrine coverage. Now we are talking of 88, almost 100. Within the last 6 years, we have been running it in Eastern region of Teso, in West Nile, and in Lango region, and some few districts of the eastern part of the country. So we think really with the funding, we can really turn the tables and reach
funding
the
from
middle.
Where?
From government and our friends.
Okay, I have a caller on the line. Hello. Hello. Talk to me. Okay, we're just losing that call, but they're at the office. But you guys in government, these are conflicting signals. One time you tell us, we want trade, not aid. Now you're saying, hey, give us some aid and then we shall be open defecation free. Well,
but when you hear...
But I guess that's not your docket, to be fair to you.
Yes.
That's not your docket. I'll take on the president when he comes here. Okay, hello. Hello there. We're losing that caller also. Let me go to Francis. Your propositions on the way forward for us as a country.
Thank you. One, I want to first say I had an opportunity to be in the review meeting for that Global Sanitation Fund. And I want to give testimony that this is a success story for Uganda and Africa at large.
Right.
And I would want to see how we are picking such stories of a fund that has looked at a ministry level, a district level, and a service level, reducing open defecation and showing us that a little investment in sanitation gives you ripple results, in fact, into the development arena.
Okay.
So as a country, for me, I'm still advocating that we should make sure that no other child dies for a preventable cause as sanitation. As a country,
do we have any particular reliable statistics
Yes.
in terms of a nexus between investment in prevention and then reduction in deaths and reduction in spending on treatment?
Yes.
On sanitation-related diseases?
Yes.
Do we have that?
Yes.
I'm going to pass it to Commissioner because she's
Briefly,
the bearer.
have a second, have a second,
Yeah.
have a second. What is that?
When you look at the figures currently, you find globally 1.5 million people die of water sanitation related diseases and hygiene, but poor hygiene practices.
Okay, just
And
hold it.
here in the
I've got a
country-
caller waiting on the line. Let me just take them and see if they'll go through this time. Hello? Hello?
Hello,
Yes, Bwana. Okay, we're having issues with the calls there, but just finish your statement, Julian. Sorry for the interruption.
And when you come back in the country, I talked globally, 1.5 million dying of sanitation and hygiene, poor hygiene practices.
Every year?
Related every year.
That's
here
a lot
in the
of people.
country.
That's
yeah,
a lot of
globally,
people.
globally. And here in the country, 40,000 children die from diarrheal diseases. That is a fact, because we have the statistics in the HMIS. Then
And that
when
is under 5?
under 5. Then you go to other people also dying each year, or preventable now, lumped together. Preventable diseases. Because you know immunization is also a form of prevention.
Yeah.
These nets you are seeing, mosquito nets, that's also prevention. So prevention is not only in sanitation and hygiene, but there are other areas which are prevention. So we are emphasizing that we can save 95,000 people who die each year in Uganda because of preventable diseases. And then globally, 5 million people. That's quite a big number.
Yeah,
And
okay.
if we invested in prevention and specifically in sanitation and hygiene improvements, we can make a difference.
Great. Your take,
Yeah, the figures
Dr. Eka?
I have some figures here also, but then the percentages. And it is estimated that inadequate sanitation worldwide is responsible for 4% of deaths and 5.7% of disease burden. The percentages look small, but when you translate them into numbers, the numbers are big.
It's big.
Yes.
Even the basic
Also-
household spending on just diseases, just go to the doctor and stuff like that, that's a lot of money. Yes, Dr.
Also, it is estimated that interventions in sanitation, water supply, and hygiene reduces diarrheal diseases in under 5s by 25%, and the mortality by 65%. Yes. So you can see the impact.
And
by
is,
these
as
interventions.
government, are you doing that? Because he says, from what Francis says, there is not enough investment in this area. And yet, I know that the irony is that it's usually the small people who lose children like that. People like you don't lose children to diarrhea and dysentery and cholera. The middle class, the upper classes, you don't lose children your kids don't die like that. It's the common man's children that die from these preventable diseases. And people feel that you as government have not been responsive in that sense, saying there's a problem on the ground, we need to react because your children are safe. The other kids, well, 50% die before 5. The basic statistics. You don't give a hoot about it.
No, I think government is doing a lot. Because this funding we are talking about of sanitation and hygiene, 85% of the funds go to local governments so that we reach the communities. It is the communities, the people, who suffer more. Of course, our children will not have preventable diseases or sanitation and hygiene related diseases. But the community down there, because this program was people-centered And also government.
A very political statement, by the way. People-centered.
It's a technical statement. It's a technical statement. You must be people-centered if you really want to deliver services to the people. And this program has delivered services down to the grassroots. 85% of funding. That's why we are saying, as government, we must take maybe 90% of the funds down to the people who need the services more.
If they don't steal them before they get...
I am not aware of that. I don't know.
Oh, you don't know. How convenient. Okay, 30 seconds each to each one of you to wind up. Let me begin with the doctor.
Well, I can say that...
The hosts for the celebrations.
Yeah. That we are set, call is set for the function, and everybody is welcome. There is a lot to learn. Because Chikole was chosen because of its good performance.
Yes.
Yes. So come and learn from us, and of course we shall also learn a few things from you as we interact. Then too, I want to say that let's not look at having the facilities in place without the issue of behavior change. You know, in that way that we need to use them. People have toilets, but they may not be using them appropriately. Hand washing facilities may be there, but people are not using them. So that behavior change is a strategy we must also work on strongly, so that people change the way they do business. So that's not business as usual. People should wash their hands before meals. People should wash their hands after meals. People should even wash their hands before they prepare the meals. Then lastly, I want to say about leaders.
Briefly.
Yeah, these leaders, that they need to be exemplary. Okay?
Okay. I'll stop you there because my time is up. Julian, 30 seconds.
Thank you very much. I'll go by the theme of Sanitation Week. Good sanitation, how is your leader? We call upon leaders to live by example, right from the grassroots to the top.
Okay. And Engineer Francis.
Thank you very much. We call upon leaders at all levels, at the national level. As the president, we call the Minister of Health together with the commissioners at the district level, but especially leaders of households who are the men, the women, to make sure that there is attention attributed to sanitation. It's a leadership question. Let's make sure no child dies due to preventable cause diseases that are linked to sanitation. Thank you very much.
Okay, thank you. That's all we had time for. Just a quick word. This is Sanitation Week, the week before World Water Day, Friday 16th. Just a quick word. If you go to the bathroom, please wash your hands. From me, Gawa Tegule, and all of us here at NTV, God bless you. Bye-bye, and stay with us.